The Prime Minister and Health Secretary have addressed the current NHS crisis. Steve Barclay says hospital capacity problems are being caused by patients who do not need to be there. But where else are these pressures coming from? Here you can see all 19 regions where NHS trusts have declared critical incidents in England during the last week. This is not normal, even during a very busy winter. It shows what pressure the NHS is under. The biggest issue, what is driving this pressure, is the lack of social care for patients who are medically fit to be discharged. There are over 12,000 people in hospital that don't need to be there but can't be discharged safely into the community. People are being urged to call 111 unless it's a real emergency. In the week before Christmas, 600,000 people called the service. That's up over 2/3 on the same period last year. And almost a third of callers abandoned their calls before they were answered. And for patients trying to see their GP, there are also big delays. Despite pledges by the government for 6,000 new GPs by 2024, the number of fully trained GPs has fallen by almost 2,000. Health leaders say these pressures are driving up excess deaths, not counting the number of people who've died from COVID. Over the last 6 months, there have been an average of 800 extra deaths per week compared to the 5-year average in England and Wales. Health analysts say this is largely down to delays in the NHS, but NHS leaders and the government dispute this.
It's impossible to work out precisely what makes up those 800 excess deaths. And there are many possible factors, in particular the consequences of the pandemic, the delayed treatment, what you might call, the chronic delayed care that people are, have been receiving. It's quite plausible that hundreds of those cases, an estimate has been made between 300 and 500. And I think it's quite plausible that of that sort of order of magnitude could be attributable to the delays in people getting into hospital.
The warnings of a triple-demic COVID, flu and emergency department pressures have been sounded for some time. Health leaders said this could be the worst winter in the NHS's history, and it looks like those warnings might be coming true.